4A has signed an agreement to give all of sales tax that they get to the city to pay the debt. The debt still comes in short about $122,000 a year. And then operations, there's no money there for operating. So that's
What's the
what we have to
difference of us
do.
partnering up for the parking lot and then turn around and partner up for the sign? Instead of saying put all the eggs in the basket for the sign, just say, how about we show a partnership with the, I mean, can we take it back and say, here's our partnership for the sidewalk. If you need 200, 300, 150 for the sign, we show, I see the more economic need to advertise for businesses on that sign that leads more towards our goals than spending 100% towards the parking lot.
And another thing is sometimes you don't always have to do everything at once. I mean, the sign, we're talking $500,000 on the parking lot and turn around and do a sign, and I'm sure it's gonna cost $150,000.
You said 300,000.
300.
So,
wow.
Can we do, what does it say before we entertain, could we go out and get, I guess the attorney's not here, could we go out and get bids and get it
You
more
can't,
realistic?
you're not being.
But if we
But you're not
voted
being
to,
fair to the bidders to bid something when you don't have the funding to actually pay
Yeah.
it. So those
Yeah,
people put a
that's
lot
fine.
of time and energy putting those bids together, thinking, okay, you're gonna award the bid, and then you go, well, nah, it's too much money back to, you can really do it, but, and actually, in all good faith, you need to be able to say,
Yeah.
I have the funding, I'm able to do that. So in order for the city of Floresville to go out to bid for this sign.
but if it, one doesn't address, would we go out for bids and it'd be our project, or would it be the city's project? That's the question.
Well, see,
If we're gonna pay 100%, that way they can do it to our guidelines versus giving it to y'all.
Well,
I don't know if you're attorney.
And the other thing, I mean, we're turning-
Technically, I gotta bring in the 4A at some point in time, because I know I had like an homeless place for a reason, they
But-
won't pay.
we're gonna turn loose of $500,000 that we don't have any control over, and we're stewards of this money.
We did that already, and look where we're at, there. Yeah, they got the phone call today.
And
I
Someone
still
called
think
Floyd,
that we
said
need
there's
to
another
partner.
activity.
I don't know if I called
Really?
you, I had it down for
You
a
need
while.
to call him and right now, because he called about 30 people, it's already the baseball field talking about moving.
About what?
No, the only thing they said is they don't know if the lights are gonna be done 100% to play that 7 o'clock game on the old field, in case I don't have the lights on.
What, how much money do we have in the hotel motel fund?
You get about $180,000 in multi-monthly tax a year, and I have about $300,000 in there right now.
And they want to spend more than that on the sign?
I still maintain though that if we're gonna partner with the city, then they have to make the hard decisions. What's more important, a parking lot out here or a sign? We've been without a sign for how many years?
The parking lot has priority. The parking lot has priority.
yeah, I mean, the parking lot, I mean, it's crumbling away. I mean, we can't argue that. Nobody's in disagreement.
We don't have to do everything the first day,
Yeah.
in the same day.
So,
Take some steps.
forego the sign and let's people, whatever we have, and as much as we can, you know, reasonably for the parking lot.
But we're talking about the sign, but the request isn't about the sign, right?
Yeah,
The
I
request-
mean,
It is.
they're not asking us to participate in the sign.
it's
They're asking us to.
But I'm asking, let them.
Yeah.
They're not wanting to pay for anything else because they want to put all their dollars on the sign, and that's,
Our action should be regarding the parking lot, regardless of whatever action they take on the sign.
Well,
I think we ought to hold our ground.
Danny, the thing is that their part can't come from anywhere else.
25.
So do they want to sign and then
Back here.
leave this gap with us? Because we can't, I don't think.
We can't do
should-
both, right? Yeah.
No, I think we ought to stick to our original plan and just fund, what was it, 270? How much was it?
75% at 220.
250 or 225?
It was up to
Not to exceed.
75% of the cost of materials and no more than 250,000.
227,000.
227 from memory.
It
No,
was
no,
250.
Was it?
It was 250.
227 was the
Yeah.
Yeah,
lowest.
but
Tommy, with that commitment, if we come up with that, could Henrietta go out for a bid with that number?
Sure.
Was 250?
I think it was presented where we were gonna buy the materials, the city was gonna pay for 25% of those, and the city was gonna do the work. Now it's that they want third parties to do everything. And so, I don't,
But I'm saying, is that sufficient commitment for her to legally go out for a bid, or ethically go out for a bid.
I wouldn't think so, but, you know, I didn't think we needed Chris tonight, but I can call her. I just, I don't know how it works if we go back to council and say, you got it all wrong. We're not gonna pay 100%. If they say, you know, if we get into a cat fight, who wins? I don't know
I
that.
think we want to fight with them, but even technically, this thing never really got to a vote. So how are they requesting something that never happened at council meeting?
I think when they said,
They just, you know, tabled the other one, our office, and then they said, we'll just go to the FEDC and get 100% for the whole project, do it, you know, third party, like you
Right.
said. But it never came to a vote where they can give us a resolution that says FEDC, or will you do it?
that's right, it was just verbal.
It was just somebody talking.
And the council voted on it, and there was
They
4
voted
votes.
to table it, not to do anything else. To table it.
I wish,
I'm not an attorney, but I don't think we can go out for bids on our proposal of 75% of 250, not knowing if they're gonna pick up the other 25.
I understand that. But it seems to me like this item is not officially over here yet. You know, we've got, later in the agenda here, we have a vote, a potential vote on something that hasn't been given to us officially.
You have a good point.
And again, I'm for helping out, but I'm not sure that we're doing the right thing with what we have in our responsibilities in other areas, when there is money being spent on something that I think is not as important as what we're gonna do out here. Let's partner with them, let them forego the sign and give us whatever, and then reasonably, I think we can come up with some money.
But you have a fiduciary responsibility to be a steward of the citizens' money, it's not our money. So
100% with you on that. But my point is, you know, the $500,000 to me is.
Discussion got too hot.
But if you understand what I'm saying, this still a partnership, should be. You know, hard decisions have to be made. What do we want more? The parking lot, which I think is very necessary, or the sign. The sign can be put somewhere in the future. Or a smaller sign.
Greg got here with that camera and everybody left.
Again, I'm for helping out, you know, and that's fine.
Everybody here, I think, is in agreement to work and help out together. You just don't want to carry the whole
The
burden.
first one that brought up the idea of even helping out.
Does the FEDC, do we still have a budget for signage?
We do.
We do.
It's 30,000, so that ain't gonna go too far.
And,
Sponsored by?
and not to exceed 7,000, right?
7,500.
7,500.
It's 15 total.
We can tell them they can apply for the grant.
Fred, asked Henrietta between phone calls, I said, Fred says that it was, they voted to table the issue.
Right.
She said, that's right. And I said, well, the board, I don't think the board's buying this 100%. So what comes next? We need something from council in writing that says this is
Kind of a
what we
resolution,
expect.
like we had it on the sports complex, not to say that we can afford to do what they need, but even technically, I don't think we have it within our ball for it this time.
Is this FEDC, is this considered more infrastructure? Because we're not allowed to do infrastructure for the city. Would this be considered infrastructure? I mean, it gets, when you're talking about a parking lot, I mean, you know, we couldn't help on the water lines.
Materials is different than.
Yeah, I mean,
And because the location of
But-
being part of the event center, part of the park, I think that's.
I think it works because that the stuff downtown is gonna be,
But what says we're not, you know, eligible to pay for?
It is a parking lot in
I don't know of anything.
No different.
What says that we are not allowed to pay for infrastructure? I'm not aware of that.
it's somewhere in our I think
In
by
fact, I
state
think
law,
that's the
No,
only
we
thing you
can.
can pay
They
for.
did the Walmart, they did the
4B can
Walmart
pay
next
for
year.
it.
I think that's the only thing you can pay
But
for.
I think that Carissa's already looked at this,
business.
okay, that's right.
and I think Carissa's already looked at this from an
I
attorney
think that's-
standpoint.
There's no
and
prohibition on that, it's a
She
matter
didn't
of
say,
getting to it.
you can't fund the parking lot. I mean, she would have said that right off. So I feel
No,
like
she wouldn't
that,
have. It's just not like
that
that.
we can fund if the board wants to, and at what level.
Right.
So at this point, to making, having the council write up a resolution, I mean, is that even the right thing to do? If we're not going to agree?
So I think what we need to do is maybe have a joint workshop with the city council. Sit down, I know it would be hard, but sit down and talk, say, what are the goals, expectations?
Okay, so I know I led the meeting, but you're saying that they're gonna have to choose what they want a partnership on this big ticket item. Either choose the parking lot or the sign.
Well, the sign hadn't been brought up, I mean, that's not on the
The
table.
sign has not been brought up to FEDC yet.
It's the parking lot.
Yeah, it's
Yes,
just the parking
we're
lot.
not talking us paying the sign, I'm saying that money can be used to partner with us to meet that 500,000 requirement.
Well, on the agenda for
That's all I'm saying.
Thursday night is actually, the engineers there to present, it's a presentation type of thing. Doing that presentation to talk about where we are and all that kind of stuff, because I think one of the councilmen said they hadn't met the engineer who designed it.
Well, I think what I'm talking about is not so much just a joint session on the parking lot, but on, like, what we talked about, we have our goals that we talked about, just saying where our vision is moving forward as a board, so they understand that if we do this, maybe some of these goals and visions that we came up with in those meetings can't be met if we go fund this extra money. I don't know. And just get a directive from them saying, is this a direction they want us to go for the city as a unity working together?
And at this point, we don't know what those goals are going to do to the budget, right? We still have to see that.
Yeah, because we said we wanted to help with getting industrial or the housing in here and stuff like that. If we just go,
You know, if we're talking about.
$750,000.
I think I figured 600,000 for the parking lot and then the downtown lots and the 50,000 for the ADA. We're bumping the $1 million.
No, it's $777,000.
Well, okay, but what he's getting at, or what y'all are both getting at is, if somebody came to town, it would impact, because we have to have our reserve money, and I don't want to just be riding on the bare reserves.
So what do we have to do for that, if we need to sell that property, the industrial park, to put that bridge across? What if they?
Yeah, I mean,
what
there
would that
could be
cost?
expenses, if somebody comes to town and says, look, if you'll do this,
60 to 100
we'll
grand.
really bring 200 jobs.
If you're going across
And
60
we need the
foot.
money.
So
And,
typically, the council will do on what I'm calling off weeks, so the week that they don't have it, we can make it available for, they like to meet Thursdays, kind of have it. And so we can look at the Thursday, but on the 29th, they have a workshop already scheduled, I know I can speak for that. So we're looking at April for a joint workshop. And I can bring it to them and see what's available for a date. But if you look at the off weeks of council, then that's a Thursday, we can look at a Thursday. I know you all typically meet on Monday.
Of the
April.
29th of it.
The 29th of March, they already have a workshop.
Oh, it's still.
So I already have a workshop, it's already posted for the 29th.
and we can't get into that workshop along with our subject, or it's too close. No, it's not too close, we
Not
can't.
too close, but it's a whole other subject. I'm talking schools and
But it's like,
everyone's prepared.
Well, they can do us first and then they can have the school.
don't make the
I
payments early.
can see this being a long conversation.
Here's a,
So we have a meeting on the 12th. I can see if we can set something on the 5th or the 19th. Because I can see this being a long conversation rather than to do that and not have the school and policemen and other things for emergency preparedness. That's not kind of the same subject.
Okay.
so what's the objective of the workshop? For them to understand that we can't pay for all of it? Is that
No,
the
just understand
objective?
that if you go and spend that kind of money, what does it limit you to as doing future projects as a board?
Well, I don't know if that's a valid thing, I mean, that's not really been, I mean, I understand your concern, but I don't know that it's enough for a workshop. They're gonna read the newspaper and watch the videos, but, they, I mean, it gets burdensome. I mean, it's like, we're not a slush fund for the city.
But you need to express that to them. That could be, the purpose of the workshop is for you to have a dialogue, just.
You know, we can work with the city, but we're not a city fund.
But the dialogue would be between your board and the city council, so they can go back and forth, and they can hear your perspective, and then you can hear their perspective, and then go back and forth, and then staff can be there to listen, so we can take the directive, that'd be Mr. Baker and myself. Say, what is the flavor that they're trying to come back with? So you can express your concerns to them, and they can express their urgency and their needs.
We just initiated, sitting down and trying to set some meetings up about the budget coming up this year, what we have available, what we don't have available, what the drop, what the increases are.
I mean, because there's some things that, I mean, as we get ready, and I'm gonna be doing budget, talks in July, and I talk about EDC all the time, but you know, you budgeted in this budget year, $50,000 to maintain your wonderful park. So I'm gonna be going out to bid to have somebody come up with those kind of things to maintain their park. Those are things you may need to be take. I have some new council members on that board. You all have some new members on this board. Maybe you all can get together and we can come up with a discussion on how we want to proceed, or at least come up with a priority of capital projects. So then you can prioritize them and say, this is number 1, 2, and 3, and we can tackle them as they come forward. Just remember that the $6,000 idea for the entryway, I'm paying it off with the cutting, right, Mr. Baker? Give me my deal. We went and found that piece of paper, I didn't know it was this significant. I'm cutting the grass. Do you all know I'm gonna cut the grass? I'm keeping it, right? I got a long way to go, but.
Can we get a picture of you on the lawnmower?
You know, that's not a bad lawnmower, it's a tractor with air conditioning and it has a CD player inside.
Okay, well, I want to see a picture.
No wonder the city has so much money.
Can we sell that to
You
take
voted-
this?
you
I voted for it,
Yeah,
so
you
I
voted
voted
for
for that.
Voted for that new tractor. So.
And you stole one in front of the Catholic Church.
No, you left it, and so, you know, possession.
That was theft. The old man broke down or something and he stole
Possession,
it.
you should read the newspaper, I put it in there, it was gone, and then I took it. So, you know that, so, you want to look at the 5th of the 5th?
Well,
The 5th of the 19th, which one looks better?
we have a meeting on the 19th, right?
No, we have-
No, the 12th.
The 12th
and
to
the
the 26th, yes,
okay.
ma'am. So you want to talk to the 5th of the 19th?
19.
The
Really
19th?
in the morning.
You think it's the 19th? Huh? So we'd like to do that? Great. So I'll let the council know that you're looking to do a meeting, a joint workshop meeting, so that we can address capital projects.
On the 19th or?
We're gonna try for the 19th. That's what I'm gonna bring back to the council, that you'd like to have a workshop for the 19th. And it's just gonna be discussion, and we can list some ideas, and I'll get with Mr. Baker as to what we wanna list. Is that okay?
And our attorney will be there to, whatever happens, she can bless it or.
Okay, you bring one, I bring one. You bring your lawyer, I bring mine. All right.
Who's gonna bring the sandwich?
I can't do that on the 19th.
Oh, you can make the 19th?
That's okay.
It's better for you?
I'll just be gone an hour. I have a 40-minute walk. 6 to 7.
Oh, I can see that meeting going longer than an hour.
I'll be back.
Yeah.
Okay, great. So they're gonna have a meeting workshop on the 19th. We will go over that. To talk about one of the projects that we want to do with partnership with DEC. All right.
So we're gonna go backwards now. And the new business discussion item number 9. And possible action item, Mr. Monty Small, Atascosa Health Center, you can introduce your staff.
Thank you very much. It's an honor to be here with the board to talk a little bit about Atascosa Health Center. It's warming up, and I'm pausing while it's warming up. And we have just a small presentation that we want to put together, where it's basically going to be, give you a little bit about Atascosa Health Center, what do we do, and tell you a little bit about the history, and then go from there. It's getting, I don't know, is these 2 lights turn off up here?
One of them, hopefully, yeah, one panel. Good.
Is that better?
Try to see if it's totally dark.
No deal.
You turn on both.
That's good enough.
Is that good enough? It's coming to focus now a little bit. Anyway, this is our Wilson Community Health Center. I'm going to talk a little bit, what led us up to Wilson Community Health Center, as soon as the computer wants to work. There we go. I left my little clicker at the office, as they said. Think a little bit about Atascosa Health Center. First of all, our board of members, we have Carlos Munoz, who's one of our board members, represents Wilson County, and of course you know Luana Luman Luz, she's our other board member that we have. Christina Rodriguez is our practice manager that we have with us. Maria Tenoyo is our HR specialist. You want to pass out the handouts? We do have the handouts of the presentation so you can have it. To make it a little bit easier so you don't have to scribble from notes and stuff within there. We also have Sherry Frank, she's our Director of Corporate Compliance within there, and also Maria Garcia, who's our Chief Financial Officer. They will be helping me do the presentation within there. This is a little bit about the mission of Atascosa Health Center. Some of you have seen this before in the past within there. I know back in 2007 when Daniel was mayor, that's when we started in Floresville here. And our mission stays true within there. You can see the counties and then of course our vision. I'm not going to read this, you have it in your handouts just to save time. You can read it later and stuff within there. We started in Pleasanton in 1982. And actually it was 1979. These are our sites that we have, and we have 6 sites right now. We have Atascosa, we've been there since 1982 in the Pleasanton side. Carnes and Wilson, we opened up both of those sites at the same time in December of 2007 within that. And that was because Carnegie Memorial came to us back in 2006 and said the community really needed a community health center. And what is a community health center? We're going to talk about that in just a minute. And of course we have Live Oak, Mulholland, and Lytle, and we're looking at opening up another site in Poteet within there. And Poteet's where we started back in 1978, by the way. This is our service area. You can kind of see where we're at. We're in 5 counties. We have little 5,000 square miles that we serve. And we look at partners, how we can partner with our community. What is Atascosa Health Center? Well, we have to say, we started in 1978 as a rural health initiative within there. We're located at Atascosa, just because we started in Atascosa County. We moved to Pleasanton in '82. The 330 grant is our main funding. It's a federal grant that we get. That gives us the means so that any patient who walks through our door, and Maria will be talking a little bit about the sliding scale fee, we see them. We don't turn anybody away. And we don't, so when our providers are in that exam room taking care of the patient, they're taking care of the patient. They don't have to worry about how they're going to get paid and so forth. We have sliding scale fee, so Maria will talk about that. Other qualified health center. We have 5 core mandates. These are what drives community health centers. Close a volunteer board. If we didn't have board members, we wouldn't exist with it, just like you guys are as well. We have 9 to 25 members. We currently have 4 board members. The board members are made up of community members from each one of our 5 counties. Most of them are coming from Atascosa County. Why? Just because we started there. No other reason than that alone. And they're all from a service area. We have to be located in an MUA, a medically underserved area, or an MUP, which is medically underserved population. And that's what we were. And that's where we're at right here. The other 5 core members, we're a 501c3 organization. We offer competent primary health care. And we have to establish a way our patients can pay or not pay us, and we still take care of them. And that's the key, what sets us different than any other healthcare provider out here within them. This is the Wilson Community Health Center Provider Team. We have Dr. Irish, she's a dentist, she's also our dental director. And then on the medical side, we have Dr. Salazar, his family practice. We have Dr. Nair, he's OBGYN. And then we have Dr. Thompson, she's pediatrician, she just joined us. And you know we have another pediatrician in the community up the road also within that the hospital has. And then we have Gabriel Eckhart. Unfortunately, Gabriel is leaving us shortly, but we'll be replacing him and finding another nurse practitioner. And then, of course, we have Pamela Clark, and Pamela has been in the community for some time, and some of you may know Pamela. And now the services provided, I tell you, I'm going to be quick, because I know I want to keep this brief so we can get out of here and you guys can get on with your business. Sherry, you want to go?
Sure, and I'll try not to take so much time, but it's really important to understand what type of services we provide. By the way, we are accredited by the Joint Commission, so we provide high-quality healthcare services, and we're privileged to have them come out every 3 years to do on-site assessment of our practices and making sure that we're delivering that high-quality healthcare. And we offer the services that I'm displaying up on the wall there for you. We also have the benefits of a 340B pharmacy service. So basically we can bring very low-cost medications to our patients. An example would be our diabetic patients. If they're taking Atlantis for $100, we can offer them that Levemir alternative. Does the same thing for dollars, literally just a few dollars. And I'll speak in just a few more slides about another example of how our pharmacy services work for our patients. Behavioral health is very important to us, so we partner with Camino Real here at our Wilson Community Health Center. They have an office in our location, and we also have what we call an OSAR, which stands for Outreach, Screening, Assessment, Referral Services. And that's for our patients who are seeking alcohol and tobacco, substance abuse, support groups, linking them to care. So if we need to provide that service, we have someone in the building that can help them. But we definitely cherish our relationship with Camino Real in helping our behavioral health patients inside our clinics. The unique thing also that we can provide our community is we can take advantage of state-funded programs. So 2 examples that we can share with you and how it reflects in our community members. We have for females, Healthy Texas Women. So we can actually provide services depending on income, and Maria will talk more about the money in just a second, from 15 to 44, and we can provide them women's health, family planning services, which covers contraception methods, breast and cervical screenings, diagnostic services, and then we can also test them for cholesterol, hypertension through high blood pressure checks, and also diabetes. And then we also have a program that we target our male population as well as females. That is our program for 18 and older, and we're focusing on prevention and health maintenance. Immunizations are covered in that program, and cancer screening services, again, are offered through that, as well as family planning and contraception services as well. By the way, at the Wilson Community Health Center, we have 460 patients that are on these 2 programs. We offer other programs, but just those 2 alone, we have 460 of our patients getting the benefits from those 2 programs. We also have some grant-funded programs because we believe in collaborating and developing relationships. So MD Anderson is a very big partner with us, as well as American Cancer Society. So when we talk about cancer screening and prevention methods, they have a grant-funded project for our patients here in this community to screen for colorectal cancer. We do a yearly FIT test. Those are free to our underinsured and our uninsured patients. We have, and that's been a champion project on my team, we've taken our colorectal cancer screening rate from a low 9% to a 65%. I mean, we really knocked that out of the park. So we pay special attention to colorectal cancer screening. In this community, we have 669 patients targeted in the age range for screening. So we really want to be able to screen all of those patients. And also the American Cancer Society has given us a new opportunity. We just started this project with cancer prevention through HPV vaccination. So we target our 11 to 13-year-olds, which is where Dr. Thompson's going to really help us on that. But this project, we're focusing on education. We do offer vaccines. That is currently an optional vaccine, but we really focus on education, and driving that HPV vaccination is more of a cancer prevention method. Hepatitis C is targeted for our baby boomer population. So if you were born between 1945 and 1965, you can be screened for hepatitis C. The great thing about this program is hepatitis C is now curable. Through a 12-week program on Harvoni, which is a $32,000 pharmacological treatment program, we can give that to our patients for an optional $8 through that 340B program. Yeah, not kidding. In your community, which by the way, I grew up here, so these patients are family. This is my community. We have 9 patients on this hepatitis screen. We have 8 in the queue. They're going through the treatment process. We have 1 that's successfully been taken through the curative treatment for nothing. Methodist Healthcare Ministries is another great collaboration. We have partnered with them, and they offer us another program to offer prevention care for patients who have at least 2 of the 4 listed here. So we have hypertension, diabetes, obesity, depression. So if you have 2 of the 4, we can enroll you into this special program. Currently, I have 36 patients in this community on the program, and we are in open enrollment right now through the end of June, so. Now, types of insurance, we see everyone, and so I'm gonna turn it over to Maria, because she's the money lady. So she'll explain what kind of insurances we take.
Hello, everyone, and good evening. Okay, the types of insurances, we offer them at